So we're going to go ahead and get started. But first, I'm going to go ahead and give the medical disclaimer. The information provided is for educational purposes and is not intended as medical advice or a substitute for medical advice of a physician or other qualified healthcare professional. We do not aim to diagnose, treat, cure, or prevent any illness or disease, and you should always consult with a doctor or healthcare professional for medical advice or information about diagnosis and treatment. And the information in this presentation has not been evaluated by the Food and Drug Administration or any other medical body. So, good morning, good afternoon, good evening, wherever you are in the world. This is Dr. Dori Narbo, and I am your host on today's call. For those of you who don't know me, I'm a clinical researcher and an author of several books. Welcome, everyone, to our Tuesday call with Clayton Thomas, who is the founder of Root. Clayton has over 25 years of experience in the health and wellness industry. And for the past 16 years, he's focused on detoxification and supplementation formulas with a simple philosophy: cure the cause. Hello, Clayton, and welcome to the call.
Happy Tuesday.
Hey, hey.
And the proverbial weekly question.
What is that?
What's the subject?
Well, today we're going to talk about neurotoxicity.
Oh, yes.
Mm-hmm. So last week, of course, we had your Q&A. So we're just going to jump right into it about neurotoxicity. We did this back, when we first started doing these calls, but I thought it would be nice to revisit it because there's some new changes that I thought were really interesting to talk about now, especially what's going on. So neurotoxicity occurs when the exposure to natural man-made toxic substances, which they call neurotoxicants, alters the normal activity of the nervous system. So this eventually disrupts or even kills neurons, key cells that transmit and process cells in the brain and other parts of the nervous system. Neurotoxicity can result from exposure to substances such as drugs, like, for example, chemotherapy, radiation treatment, organ transplants, as well as exposures to heavy metals such as lead, mercury, and also, of course, cadmium, certain types of foods and additives, pesticides, industrial cleaning solvents, even cosmetics, and some natural occurring substances. And symptoms can appear immediate or after exposure, or can also be delayed. So neurotoxicity is really a fascinating field, especially in the aging population. And what's interesting is the correlation of heavy metals and sound sleep between Parkinson's and Alzheimer's, which goes in hand with the glymphatic system, which we discussed a few weeks ago. We just want you to see the connections along the way because there's new things. I mean, literally new things that just became available a couple days ago. So Parkinson's was first described by a physician, the physician Galen, in AD 175, but the name itself comes from a London doctor named James Parkinson after his essay on shaky palsy in 1817. Parkinson's disease predominantly affects dopamine producing neurons in specific areas of the brain, leading to a reduction of dopamine in the brain. And this plays a vital role in regulating the body's movements, which is responsible for many of the symptoms in Parkinson's disease. And the onset occurs in people over 50. However, some experience symptoms as like, for example, under 40. And more men are likely to get Parkinson's than women. So this is an article that was fresh off the press, October 28th, 2021. And in the past 2 decades, Parkinson's disease has increased by 63%. So researchers say that this cannot be explained by the aging population. Something's happening. So the higher death rate among Parkinson's patients may be partially linked to increased risk, which is becoming more common due to worsening environmental factors such as elevated exposures to pesticides, heavy metals, air pollution, and herbicides. So I thought this was really interesting that this is happening. I mean, it's really significant, this 63% increase. And there's something also new that in patients with Parkinson's disease, the dopamine producing neurons and the microglia cells, this is actually the immune centers or the immune cells of the brain. So they accumulate fatty molecules that may promote inflammation and disease progression, according to this new study. Researchers suggest that therapies capable of restoring the balance of the fatty molecules between the brain cells could lessen disease progression. So that was a really interesting study in terms of what they're looking at, and they're looking at two different types of lipids. They're looking at triglycerides and diglycerides.
On the fun part, and I don't know if you'll dive into this, is we look at neurotoxicity and neurotoxicology, but there's another component that the medical establishment has helped create in this environment, and that's through the use of statins. And you could make an argument of this being intentional because of the knowledge that's really available. But the highest concentration of triglycerides and cholesterol is actually in your brain, and taking statin drugs to lower your cholesterol is actually um, a primary cause for neurodegeneration over time because of the lack of cholesterol that's pulled
Yeah,
out of
so
your.
there you have the other side of the coin, right? Here there's too much, and then you have the other side where you don't have enough.
And when you look at the too much aspect, it goes into many of the conversations that we've had before of what fat is. Fat's a storage medium, right? For heavy metals, other environmental toxins, and a protective mechanism for the body. So we know that lead, aluminum, and mercury are highly neurotoxic. So if they were to build up in the brain, or if you had more in your body and they cross the blood brain barrier to go where they are, your body would do what it can to try to sequester them, because if they become loaded in your brain and in your neurons, you can cease to function. So much like a fatty liver, you can have a fatty brain if you're really toxic.
Right, which begs the question about, lifestyle and obesity and all these other issues that play into it, and certain types of vitamins as well, which we will get into.
Oh,
So let's look at Alzheimer's. According to the National Institute of Aging, Alzheimer's disease is named after Dr. Alzheimer's. In 1906, Dr. Alzheimer's noticed changes in the brain tissue of a woman who had died of unusual mental illness. Her symptoms included memory loss, language problems, and unpredictable behavior. And after she died, he explained her brain had found many abnormal clumps. Now we call this amyloid plaques, the tangled bundles of fibers, and which we call tau, or the tangles. And that as more neurons die, additional parts of the brain are affected and begin to shrink. And the final stage of Alzheimer's, and the damage is widespread, and the brain tissue has shrunk significantly. And most people, now they say most people experience symptoms in their mid 60s, but now we're seeing something completely different that's happening. So this is just hot off the press. Actually, this we found this yesterday. What's today's date? Is today the ninth?
it is the ninth.
It is the ninth, and this came out yesterday, right? So this is published in the Journal of Alzheimer's Disease. Introduces the possibility that there could be similar effectiveness beyond penicillin's current role in the treatment of infections like syphilis and gonorrhea. What's interesting here is the two regimens proposed by this hypothesis: prevention using penicillin via once a year, like now they want to give you a once a year shot, or a pill for 2 weeks, or for the treatment of early onset Alzheimer's using penicillin as a drug, such as rifampin, to break, get this, the biofilms, so that penicillin can break through into the body. So researchers say that the path of Alzheimer's in the tissue of patients starts with two types of spiral-shaped bacteria known as the spirochetes, which come from Lyme disease and treponema. So these are dangerous bacteria that enter the brain via the nerve cell and brain circuits, and create biofilms that are responsible for the tangles, which is the tau, and attack the brain cells that actually cause Alzheimer's. So what the research is saying now is that Alzheimer's disease is a chronic infection. Up until this point, no one has been able to find these biofilms that cause disease hidden in live tissue. So that's really interesting.
I would argue that it could be one aspect, because the rest of the research, if you look at chronic traumatic encephalopathy and chronic toxic encephalopathy, the correlations drawn between mercury and aluminum and tau development are very, very well established. So when you bring all of these together, are you creating additional pathways of chaos, with the exposure of you know Lyme and spirochetes and the Borrelia bacteria. What's really important to understand with Lyme as well, because people thought that Lyme disease was something that you just get from a tick bite, but the problem is Lyme is actually sexually transmitted as well. But unlike syphilis and gonorrhea and such, where you actually have pretty good indication of what you've contracted, Lyme is something that you can contract, and for 5, 10, 15, 20, 25 years will actually remain dormant until they start to create chaos. So it puts you in a really precarious position. And looking at the neuro aspect, it's something that could go right to your brain and cause those problems, and you never get to see anything until later on, when your memory starts to decay and you start to suffer. It's interesting.
Well, some beg to differ that it could be sexually transmitted. I'm looking at studies now about that. So
There was
we'll have.
actually a phenomenal documentary that was done, um, like 15 years ago, and they followed multiple people with Lyme, and there was a couple. There was a woman with Lyme and her boyfriend, and they
Mhm.
followed these two. As I think it's where the book Fire in My Brain started. I can't remember the name of the documentary, but it's on Lyme disease. They followed her. He was fine. She was the case study, and they went through this entire process. And at the end of the documentary, they talked about having the follow up. But what they mentioned after the completion was that through the process, her boyfriend then started to show signs of Lyme. And in the second movie, the second documentary, they talked about how I think they had broken up, but he had Lyme disease as well from her. So it's the interesting part of transmission. And if you think about it, bacterial transfer is not that difficult between two parties if they're very close.
Mhm. Well, it's very interesting. But there's another thing too, and we'll move on. Let's put that there.
You hit on that one.
Yes, but this just came out too. It's not just Parkinson's, but it's also Alzheimer's, right? So again, we can look at lifestyle, for things like this, things that we can actually change. And basically, again, it's about education, right? Educating people to look at these things and to have a better lifestyle. But I thought this was interesting about these fatty acids, that the buildup, they build up slowly with normal aging, but the process it's actually accelerated by someone who may possibly have a genetic predisposition for Alzheimer's.
Well, and that's where you look at, well, you take the correlation of uh, Parkinsonism, right? I won't say Parkinson's disease, but Parkinsonism. And
Parkinsonism?
oh, I think it's Parkinsonism. Either one. It's
Yes,
uh,
it's a Parkinson's like syndrome. Mhm.
and the progression. You could almost guarantee that if someone had Parkinson's, that if they live long enough, they're going to have Alzheimer's, because they've
Mhm.
already progressed through that phase.
But it's really interesting. The people think that Alzheimer's just develops like when you hit your 50s or your 60s, but actually they've done studies that show that it's actually starting like as early as in your 20s.
It can, and that's where you bring in the what they'll say the genetic component, but much like every other issue, whether we look at Down syndrome or even sickle cell trait, where we've thought that they're actually genetic conditions, they are conditions that are caused by damage to chromosomes, but it's mercury in early fetal development that causes the damage. So the issues that we think are actually genetic are still environmental. It's just how the impact takes place early on in development, which gets back to the primary point that this is all environmental in nature. And this is where the combination of CTE comes in, right? When you talk about 20-year-olds seeing, neuro issues, the level of mercury, the level of aluminum, cesium, strontium, cadmium, lead being a big
Oh,
one, you can go with the big three. It's it's causing the issues.
yeah, I was going to say that, a lot of these athletes that are practicing on that turf grass is loaded with all kinds of chemicals and things like that as well.
Yeah, absolutely. And that, actually, the first study on that was done in Seattle, when I still lived there, looking at soccer players, because there was a female goalkeeper in the Seattle area. I think she was like 16 or 17 years old, that developed leukemia and lymphoma, that didn't make sense. And they started looking at it and all of the little rubber pieces that they put on those fields. And it would make sense that the goalkeepers are the ones that would show symptoms quicker because they're diving on it, where, field players aren't typically going down as much, but goalkeepers are actually down on the ground quite a bit. That her exposure from a couple years of playing soccer actually caused her to get leukemia.
Hmm.
And you have to pay attention to every aspect of your environment. But the other part goes in is when you look at environmental impact, exposure to environmental toxins, but then lifestyle, because we know that there's two forms of CTE. I actually called Boston University about this when they started doing the CTE study with the NFL, that if they looked at the amount of mercury exposure in the brains when they were doing necropsies, and their answer was no, because had they wanted to do that, they would have had to change the study protocols, which would have changed how the NFL was funding them. And if you can get a couple $1 billion from the NFL, you don't change your study protocols. But the big thing with CTE is there's two forms. There's chronic traumatic encephalopathy and chronic toxic encephalopathy. It's the toxins that cause the early onset issues, because the trauma acts like a magnet, an increase in ionic activity. So those heavy metals will migrate to those areas and build up the tau quicker.
Hmm.
And that's how you see earlier development of tau and issues, because of impacts or activities that allow these to migrate to one area much earlier on in life.
Well, and as you were hitting on, I mean, the common thread between these things are first and foremost like heavy metals. Heavy metals, also such as iron, copper, lead, manganese. These are also involved in neurological diseases, and they're most often associated with abnormal environmental exposures, abnormal accumulation of heavy metals in the body, just as you mentioned, and increasing recognition that, of course, heavy metals normally present in the body may also play a role in disease pathogenesis through the free radical formation as well. So, and then this was about manganese and iron. So, researchers discovered that high levels of manganese and iron in patients with Parkinson's disease, and they recently discovered was this chronic exposure of manganese. They have high levels of misfolded proteins uh, called alpha sinulin, and in their blood, which is a protein found primarily in neurons and accumulates in the form of Lewy bodies and affects people with Parkinson's and also different, some other forms of dementia. So, current research shows a possible connection between development of Alzheimer's and heavy metal buildup in the brain and the body. In fact, heavy levels of iron were first reported in the brains of people with Alzheimer's disease in 1953. And since that time, it's been shown that cadmium and iron, as well as zinc and copper, are also associated with the hallmark of Alzheimer's protein clumps into two types of plaques, uh, the amyloid and the tau tangles in the brain. So scientists also found that there's an accumulation of heavy metals that contributes to this sticky protein in the brain that causes this damage. And then there's new research that shows that exposure to cadmium, whether it's smoke, makes you more vulnerable and increases your risk for Alzheimer's disease, especially if you're a man. And then we have circadian rhythms. They are intertwined with the neurodegenerative diseases, as are metals. And understanding this interplay between the two factors and health and disease will contribute to healthier aging. And metal exposure again has been implicated in neurodegenerative diseases, in some cases involving essential micronutrients. But again, this is the manganese, the copper, and the zinc that involve other cases involving metals that have no biological role but are toxic to living system. Again, the lead, the mercury, the cadmium, and the aluminum as well. And by the way, as we know, lead can also navigate through the blood-brain barrier. So,
Primary one.
what's that?
It's a primary neurotoxin.
Yeah. So, of course, sleep is our brain's housekeeper. It's the deep sleep in your REM sleep. This is deep clean. So, your brain is made to be self cleaning, but guess what? It can't do that if you don't sleep. We talked about this before, how the brain repeatedly rinses itself. The interstitial fluid comes up, mixes with the cerebral spinal fluid, grabs the plaque, but it has to be during this REM sleep. It can't happen it doesn't happen at any other time. So basically, the brain and the spinal cord bathe in this clear fluid all day, but at night, this surge, comes in and just basically takes the metabolic waste of the amyloid and the tau plaques and washes it away.
And I think and I suspect that's the primary pathway that clean slate's working through to be so effective with the neural pathways. But it's funny if you want to understand how deep the sleep issues are, especially in the United States. If you watch television, I'd say a quarter of of the television commercials are all predicated around sleep because there's been a process to keep people from sleeping well, right? Whether it's beds, pillows, sheets, sleep supplements, prescription medications, all things around helping you sleep. But the calcification of the pineal gland is what really controls all of that. And I think we're going to hit on that like right now.
I know. It's like, have you seen my slides? Because like you're going ahead of me. Okay, so as we discussed, sleep is one of the most important biologically necessary to sustain life. It is your superpower. And your pineal gland is one of the tiniest endocrine glands that has a huge function and a huge responsibility to produce melatonin, right? In fact, there are already published studies about the pineal gland dysfunction in Alzheimer's patients. And melatonin regulates your biological rhythms, such as your sleep and wake cycles. And researchers have studied a potential connection between increased fluoride exposure and the pineal gland calcifications, as we've discussed before. Fluoride is naturally attracted to calcium, and some researchers believe that this increased fluoridation leads to increased pineal gland calcification. So, the decrease in the pineal gland volume and the pineal calcification leads to the reduction of melatonin production. And the pineal gland has the highest calcification rate of any tissue in the body, which is why it's so important to detoxify your cells. And as we've already learned, that serotonin is the precursor to melatonin. These two neurotransmitters, along with your pineal gland, are affected by heavy metals and toxins. In fact, there was a 2019 animal study called the Trusted Source in rats And they found that those rats were placed on a fluoride-free diet for 4 to 8 weeks, experienced a greater increase in the number of pineal gland cells compared to those who consume fluoridated food and drinking water. So all I can say is for the people in the UK that's getting that fluoride in the water and the milk, yeah. So better be on the clean slate. And also, and let's not forget, I've said it before, that fluoride is a heavy metal attractor. So
Correct. Well, and it's also important to understand that your pineal gland controls the circadian rhythm of the body, but it's also the our primary light antenna. So it's what connects us to our source. And by calcifying that, it allows all of these other negative antennas that are in us, because the heavy metals are all negative antennas. But when you look at I think the important part is to understand the current environment, and brain health, as you hit on initially, comes in multiple forms, right? Because one, most people argue now that there's two brains. Two, you have neural pathways, you have neurotoxins. You've got to go get those, and that's what clean slate is so effective at doing. But the other part is when we touch on spirochetes, and we touch on bacteria, and we hit on mold and fungus and such, those go in two different areas. They're going to destroy the microbiome in your gut, but some of them can also go to your brain. So how do you do that? Well, how do you fend off a lot of the mold and fungus and parasites and such? That's where Restore is highly functional. It's what it was designed for. But then, as Dory was touching on initially, when you look at neural pathways, right, and neurotransmission, because part of the problem is a lack of signaling in between neurons. That's where you need dopamine and serotonin. And that's why Zero N is probably the greatest capsule I've ever taken in my life, because you have the ability to create as much dopamine and serotonin on demand as you need, but never going overboard. What happens is you can boost your dopamine and serotonin levels, and then instead of going really high really quick, which we touched on in the addiction piece that we've done on YouTube, is having it prolonged. So you've got a high level of dopamine and serotonin available for an extended period of time, which allows you, based on your intention, to do the things you want to do better. No, I think the key thing is, if you want to take care of your brain, you have to do it in multiple facets. You've got to clean it up. You've got to make sure that you're removing the toxins that you've been exposed to, and your continual exposure. But then also feeding your brain the other goodies that it needs just to function. And it's here's the key: there's functioning good and well, which, and I've probably mentioned this numerous times before, I'm not a huge fan of wellness, right? Because wellness is just above like functional and poor. There's greatness. That's what we all want to attain. Most of us never see it. We see it in athletics, where, we talk now about, being the greatest of all time. Having some athletes today, we have the argument of, are they greatest of all time? The real cool part is in some sports, we are working with the greatest athletes of all time in their fields. And since they've started on clean slate and Zero In and Restore, they're better. So there's always room for improvement. If no matter where you are, what you've done, what level you've attained in performance and function and cognitive development, there's more to be done. You have more room. And that's what's really, really unique about being here. And even if you've been using other products for detoxification or for brain health and such, there's room for more. Whether we're talking nootropics, like products that would say be in the same category as Zero In. If you're talking about detox products that might be claimed to be in the same category as clean slate. If you're using other stuff and you start using these, you'll find that there's other levels of performance that you never imagined. Here's one of the key things. We already have this case study done, and this is how I keep this really, really simple. And I think we do need to start posting it because the International Science and Nutrition Society has this and put it out, and we'll be doing some more stuff. But what was found with actually the world record holder in outdoor distance swimming. So you talk about an endurance athlete and an elite endurance athlete. But in a 30-day initial trial, and we've done a longer case study with him, but in his first 30 days, his reaction time was really, really important. And it doesn't matter the type of sport or actually the type of activity that you're in. And I'll use another instance here in a second regarding zero in. But with use of clean slate and zero in over 30 days, his reaction time dropped by 40%. Now, this isn't a weekend warrior that was only doing a little bit of work, and a 40% improvement can be done by natural performance enhancement such. This is the world record holder in his field that had his reaction time improved by 40%. You do that with any sport, you basically can create a new paradigm. Dopamine decreases fatigue. You don't fatigue physically. It keeps you from fatiguing. It increases reaction time. It increases speed. But if you're able to naturally and biologically, properly, safely, and beneficially, there's an article that was published studying Olympic athletes that shows that elite Olympic athletes have higher levels of dopamine and use dopamine differently than other well-trained athletes in the same sport. Neurotransmission is the differentiator between being super elite and being good or great. You want to be the best, function better. So if you're talking to athletes, and this is what I would love to see, because we have some of our members that are world champion chess players. You definitely should be using the Trinity. And what some of our athletes had proven last year, using clean slate right after exercise, I think like 5 to 10 drops right after exercise flushes lactic acid. I mean, so from a performance standpoint, it's amazing. The other cool part, we'll have the collaboration going, I think, starting next week. We have a Mr. Universe that's with us now. I mean, so I know Marco's doing the post. Ty's got a little more muscle than we do. But one thing that I will have Ty do, Ty OG, you can look him up, Mr. Universe. He's deeply rooted now. Took him about a week to really get a feel for stuff.
Okay, everyone.
Happy
Time to say
Tuesday.
good night.
Bye.
Bye-bye.
Great.
Good
Bye.
night. All the best. Take care.
Nancy.
Bye.
Thank you.
Bye.
Okay, bye-bye.
Later, everybody.
Bye-bye.
Bye-bye.
Later, later.
Okay, Jay.